Hey everybody, Christian Brindle here, back with another video, and we're going to be talking to you today about 2024 Medigap plans, also known as Medicare Supplement plans. We are in the heart of the annual election period, or entering it I should say, and the annual election period is when all changes come out for Medicare plans for 2024. So in this video today, I'm going to give you my take on what the best Medicare Supplement plan is for 2024 if you're considering a Medicare Supplement plan, also known as a Medigap. So in my opinion, there's really only two different Medicare Supplement or Medigap plans that have any type of bearing or should even be considered going into 2024. That would be the Plan G and the Plan N. We have seen probably 99% of people that get on Medicare Supplement plans over the previous couple of years now pick up these two plans exclusively. The Plan F and the Plan C were grandfathered away due to the macro bill that took into effect 2020, which essentially meant if you were eligible for Medicare after 2020, those plans were off the table for you. Now, their prices were starting to inflate and increase, so we were finding that they typically weren't even a good option anyway at that point in time. The Plan F, most notably and famously, was the only Medicare Supplement plan that covered 100% of items that Medicare did not cover. So let's remember, what is a Medicare Supplement plan? What is a Medigap plan? Well, it's essentially a secondary insurance to Medicare. So Medicare pays first. Remember, Medicare Part A and B can best be thought of as two pieces of a puzzle, right? And they fit together to give you medical coverage. They both cover different areas of medical coverage. They both cover different specific things. But when you put them together, you have medical coverage. And on that medical coverage they provide, they leave some deductibles behind. They leave behind an unlimited 20% coinsurance on most items. And so that's the holes you're trying to fill when you pick up a Medicare Supplement or Medigap plan, okay? So the Plan G is going to be the simplest plan available today. It's going to be also the closest thing in coverage that you can get to a Plan F, okay? So the Plan G has a one-time-a-year deductible called the Medicare Part B deductible that you are responsible for. It's one time a year, it's annual, so if you have to go to the hospital 10 times or 15 times over the course of the year, you're going to pay that deductible only one time, okay? Once it's met, you have full coverage as long as you have a Medicare-approved charge that you're dealing with for the remainder of the year, okay? So $226 is what that deductible was in 2023. At the time of recording this video, they haven't announced what it's going to be yet for 2024, but as soon as they do, we'll be making a video for you about that. I would estimate and I would guess that that change is going to be minor, okay? That $226 deductible is going to be minor. But the Plan G is certainly the simplest plan. It's the closest thing you can get on the market today to full coverage, and it's a very, very good option. It's probably the most popular Medicare Supplement plan nationwide still. The other plan that people typically consider is a Plan N. A Plan N is exactly the same as the Plan G with a few key differences. You're also responsible for the Medicare Part B deductible, which at the time of recording this in 2023 is a $226 one-time-a-year deductible. It's annual, okay? But you also have some co-pays with the Plan N that you don't have with the Plan G. So, for example, you have up to a $20 doctor copay. It could be less depending on the doctor, but it's an up to $20 copay every time you go see a doctor, whether it's a primary care doctor, whether it be a specialist doctor. You also have a $50 emergency room copay every time you have to go to the emergency room. Last but not least, you are responsible for what's known as Medicare Part B excess charges. Now, what are Medicare Part B excess charges? They're essentially any extra payments that the plan wants to tack on in addition to what's already been charged. It's very uncommon. It's almost unheard of. I've actually never seen a provider charge an excess charge in my entire career. I've been doing this a decade. And in some states, it's not even legal for providers to do it. So if that ever was charged, you'd be responsible for it on the Plan N, but it's almost unheard of. The main things you need to be thinking about is the deductible, the doctor copay, and the emergency room copay, okay? So when you look at these two plans side by side, the Plan G has the same deductible as the Plan N, but it doesn't charge the copays. So why would anyone go with N over G? Well, the fact of the matter is, Plan N in most markets, in almost every single market actually, is going to be a lower monthly premium than the Plan G. That is why people would consider a Plan N, because it has a lower monthly premium. I do believe if you put everything into a vacuum as well, Medicare supplement plans go up in price every single year as you get older. They raise your rates. The Plan N may have a slight, small difference in the rate increase, although I think it has more to do with insurance company than it does particular plan. But that's a story for another video, okay? So you have Plan G, you have Plan N. What is going to make the difference? Which one's going to be better for you? Well, the answer to that question is going to be a resounding, it depends. It's going to depend on where you live, the market that you find yourself in, because in some markets, that might only be a $10, $15, $20 difference in price every month between a G and an N. If the G is only $10 or $15 or $20 more than the N, can you really justify the Plan N? I would say not. I would argue not. But if you're in a market that the Plan N is $40, $50, $60, $70 a month less than the Plan G is on average, then the Plan N is a far more attractive option. So it's going to depend, in my opinion, on your market and how big of a price difference you find between the two plans. If the plan difference is minor in cost, I would recommend the G all day long because it's a simpler plan, it's a better plan. It just is, because it has less copays that you're responsible for. If there's a wide gap in price difference, if it can save you $60, $70 a month to go with a Plan N opposed to a Plan G, and you're relatively healthy, meaning that you're not going to go to the doctor all the time. This is another thing to be thinking about, right? If your usage on your plan is high and you're going to the doctor routinely, then what happens? You have this doctor copay, it's up to $20 doctor copay over and over and over again. So it might be something that you have to utilize quite frequently. The other thing is it's going to depend on your preference. I've talked to plenty of folks over the years and worked with plenty of folks that don't really matter about the economics or the math behind it. They like the convenience of not having to deal with the copay, the doctor copays, the emergency room copays on the Plan G. They have their deductible that's one and done, and then they don't have to worry about any medical costs as long as it's a Medicare approved charge for the remainder of the year. Okay? So it's going to depend on your preference, it's going to depend on where you are, and it's going to depend on how healthy you are. It will depend. And I think anyone that tells you otherwise and gives you blanket statements that one of these plans is always going to be better than the other, no matter what, is a charlatan as far as I'm concerned, and they have an agenda to push. It's going to depend on you. It's going to depend on where you live. It's going to depend on your preferences. It's going to depend on your comfort zone, and it's going to depend on your health. So take those things into consideration. Buy a plan, shop for a plan based on what you need, not what other people need. That would be my advice as somebody that's worked with thousands of folks on their Medicare plans over the course of the year, like my organization does. So these are the only two plans worth mentioning. There are several other Medicare Supplement and Medigap plans available in 2024. None of them typically provide a whole lot of coverage in comparison. And in my opinion, these are the only two you should be considering for the new year if you're considering to go Medicare Supplement or Medigap. Anyway, folks, if you like this video, if you found it helpful, do me a favor and smash the like button for the YouTube algorithm. It's going to help more people just like you find this information who need to hear this information desperately. Make sure to comment down below, which plan do you like better? We'd love to have a dialogue with you about it. There is no wrong answer after all. And make sure to subscribe for more helpful, real, authentic Medicare advice. And if you'd like to work with my organization, Brindle Insurance Services, on your Medicare Supplement Medigap plan, we're licensed in over 40 states. So make sure to find our contact information down in the description of this video. Give us a call today. No cost, no obligation to work with my organization, an ongoing lifetime customer service. We'll see you next time, folks. Thanks so much for watching, and we'll see you next time. Thank you.